My name is Rumi Minami from National Hospital Organization Kyushu Medical Center in Fukuoka, Japan. Today, I will be presenting 12-month effectiveness and safety results with BF-TAF in treatment experienced people with HIV, a pooled analysis from observational cohort studies across Asia. I have no conflict of interest to disclose. HIV treatment optimization should be focused on maintaining effectiveness while improving other aspects of care, such as reducing pill burden, enhancing tolerability, or mitigating drug-drug interactions. BF-TAF is a single tablet regimen that is widely used in clinical practice and has demonstrated safety and efficacy in clinical trials. Big STAR is a large observational cohort study evaluating the effectiveness and safety of BF-TAF in people with HIV. The study has enrolled over 2,000 people with HIV from 5 cohorts. A separate post-authorization observational safety study was also performed in China, including 3,000 people with HIV. In this analysis, we present 12-month outcomes from treatment-experienced people with HIV from across Asia who switched to BF-TAF from multi-tablet or single-tablet regimens and from TDF-based or non-TDF-based regimens. Data were pulled from the Big STAR Asia cohort, which includes Republic of Korea, Singapore, and Taiwan, the Big STAR Japan cohort, and the separate post-authorization study conducted in China. The analysis included prospective and retrospective data. Analyses were split into 2 populations. The first analysis population included participants switching from prior single and multi-tablet regimens. Endpoints were effectiveness, persistence, treatment satisfaction, and drug-related adverse events at 12 months. The second analysis population included participants switching from prior TDF-based or non-TDF-based regimens. Endpoints were changes in weight and BMI, lipid, and renal function at 12 months. Generally, baseline characteristics were well balanced across the prior treatment groups. The majority were male, with a median age around 37 years. A large proportion of participants were from the China cohort. We assessed biologic effectiveness in a missing equals excluded analysis, using a cutoff of 200 copies per milliliter, as some assays for HIV RNA detection in the China cohort had a detection limit of 200 copies per milliliter. In this analysis, over 99% of participants were biologically suppressed after 12 months of BF-TAF treatment, and results were similar in participants switching from single and multi-tablet regimens. We also assessed biologic effectiveness using a cutoff of 50 copies per milliliter for cohort with data available. In this analysis, 93% of participants had less than 50 copies per milliliter at 12 months. Results were similar in participants switching from single or multi-tablet regimens and in those from retrospective and prospective groups. Additionally, no treatment emergent resistance to the component of BF-TAF was reported through 12 months. Persistence on BF-TAF at 12 months was high, over 98%, irrespective of whether participants had switched from single or multi-tablet regimens. Similar findings were observed in retrospective and prospective groups. Overall, the safety profile to BF-TAF in our cohort was in line with that seen in previous studies. Drug-related adverse events affected 17% of participants. The most common were increased weight, hyperuricemia, and hyperlipidemia. There were no serious drug-related adverse events, and the rate of discontinuation due to drug-related adverse event was less than 1%. There were no discontinuation due to drug-related adverse events impacting bone. At baseline, treatment satisfaction is assessed using the HIV treatment satisfaction questionnaire status 2, which gives a score of 10, 0, lowest possible satisfaction with treatment, to 60, highest possible satisfaction with treatment. Our results show that before switching to BF-TAF, participants had a high level of satisfaction with their treatment. This was slightly higher, as might be expected, among participants taking single tablet regimens. After 12 months of BF-TAF treatment, change in treatment satisfaction was assessed using a similar to the HIV TSQ change tool. This gives a score from -30 to +30. A score of 0 represents no change, negative value indicates worsening, and positive value indicates improvement in satisfaction compared with previous treatment. We found an improvement in treatment satisfaction with BF-TAF both in participants who had switched from single tablet regimen and in those who had switched from multi-tablet regimen, despite participants have high treatment satisfaction at baseline. This slide shows weight and BMI change from baseline to 12 months following the switch to BF-TAF. Although overall weight and BMI change were minimal at 12 months, the range was broad. These changes were similar between participants switching from prior TDF-based and non-TDF-based regimens. These results differ from observational previous Big Stars findings due to multiple factors, such as the inclusion of a large cohort of people with HIV from China in this analysis. Here we are looking at median changes in lipid parameters following 12 months of BF-TAF treatment. As you can see, although there was some significant changes in total cholesterol, HDL cholesterol, and triglycerides, the magnitude of these changes was small and not considered clinically relevant. Overall, lipid profiles remained stable and were similar in the prior TDF and non-TDF groups. This slide shows median eGFR over 12 months of BF-TAF treatment. There were a small reduction in eGFR level at 6 months, but level remained stable thereafter. Data was similar in participants switching from prior TDF-based or non-TDF-based regimens. The small initial changes in eGFR were not considered to be clinically relevant. These changes in eGFR are consistent with the non-inhibition of tubular creatine secretion by Bictegravir and other antiretroviral therapies. BF-TAF is highly effective and had high treatment persistence over 12 months in people with HIV receiving routine clinical care across Asia. BF-TAF demonstrated high tolerability and no new safety concerns were identified. No treatment emergent resistance to the component of BF-TAF was reported through 12 months. HIV treatment satisfaction improved after switching to BF-TAF. Results were similar for participants who switched from multi-tablet or single-tablet regimens and in those who switched from TDF and non-TDF-based regimens. Overall, these data support the use of BF-TAF for people with HIV in Asia. We thank all study participants and all participating study investigators and staff. Thank you for your attention.